Welcome back to Med Bites with Morsh. Today, we're doing a deep dive into an explainer I've wanted to put together for a long time. We're doing a full evidence-based clinical consultation to demystify everything you wish your doctor actually had the time to explain about irritable bowel syndrome, or IBS. We're going to break down exactly what's happening inside your body and map out a truly realistic path forward. Think about this for a second. What if your stomach isn't actually damaged, but your gut and brain simply stopped communicating normally? Literally millions of people suffer silently for years, terrified that the absolute worst is happening to their digestive health. But the medical evidence actually shows us that IBS is a functional gastrointestinal disorder. That means your organs, they are structurally completely fine, but your gut-brain interaction is entirely out of sync. This concept brilliantly explains exactly why all your physical medical tests just keep coming back normal. You're likely dealing with something called visceral hypersensitivity. It basically means the nerve endings in your digestive tract are essentially overreacting. Little bubbles of gas or just normal digestive movements that wouldn't even register for someone else, they cause you severe cramping pain. It's like your internal volume dial is turned all the way up to 10. So here's a roadmap for today's explainer to help systematically move you from invisible pain to an empowered management plan. We're covering the gut-brain connection, symptoms and red flags, getting that accurate diagnosis, identifying your personal triggers, the low FODMAP diet, and finally, some strictly evidence-based treatments. All right, let's jump right into section 1, the gut-brain connection, and look at the actual mechanics of a flare-up. There's a really stark contrast between healthy digestive function and IBS. Normally, the muscles in your intestines contract and relax in this nice, gentle rhythm to move food smoothly. But with IBS, your intestinal muscles actually spasm. These contractions are much stronger and last way longer than normal. If they push food through too quickly, well, that results in diarrhea. If they spasm and slow things down, you get hard, dry stools and constipation. Now, here is a crucial point, and I really want this to reassure you. IBS is not dangerous in a life-threatening way. As the clinical data makes clear, it absolutely will not shorten your lifespan, it does not permanently damage your intestines, and it doesn't just magically turn into inflammatory bowel disease or colorectal cancer. You are safe. Let's move into section 2, symptoms and red flags, to categorize exactly what you're feeling and when you actually need to seek immediate help. In the clinical world, patients typically fall into a specific subtype. There's IBS-C, which is constipation predominant. That's where you're dealing with hard stools, straining, and really infrequent bowel movements. Or you might have IBS-D, the diarrhea predominant type, characterized by loose stools, frequent urgency, and pain. You might even alternate between the two. And all of this is often accompanied by bloating, gas, and that incredibly frustrating feeling of an incomplete evacuation. That being said, please pay very close attention to these red flags. If you experience unexplained weight loss, rectal bleeding, diarrhea that literally wakes you up out of a dead sleep at night, anemia, or unexplained fever and vomiting, you have to see a doctor immediately. Those are not standard IBS symptoms, and it is absolutely critical to rule out more serious diseases like Crohn's or bowel cancer. Moving right along to section 3, getting an accurate diagnosis. How do doctors actually prove you have IBS if the gut looks totally normal? IBS is what we call a diagnosis at exclusion. This basically means your doctor is going to run targeted tests to rule out things like celiac disease or bacterial infections. So getting test results back that look completely normal is actually exactly what we expect to see. It simply means we're successfully ruling out the scary stuff. But a normal test isn't the only criteria. According to established guidelines like the Rome 4 criteria, this has to be a chronic, established pattern. Your normal test results must be paired with you experiencing these digestive symptoms for at least 6 full months before an official IBS diagnosis can be made. And that takes us right to section 4, identifying your IBS triggers. Because once you're officially diagnosed, the absolute next step is figuring out what's setting off your hypersensitive gut. Triggers are highly personal, right? But they usually fall into a few key categories. A recent severe stomach bug can trigger what's known as post-infectious IBS. And because of that gut-brain axis we talked about, periods of high emotional stress, anxiety, or even early life trauma are massive contributors. Dietary triggers frequently include having more than 3 cups of caffeine a day, alcohol, artificial sweeteners like sorbitol, and gas-producing foods like onions, beans, and cabbage. Knowing those triggers brings us perfectly to section 5, the low FODMAP diet. Dietary changes can definitely feel overwhelming, but this is honestly the most scientifically proven nutritional tool we have. So let's define FODMAP. It stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Quite a mouthful, I know. But in plain English, these are specific types of carbohydrates and poorly absorbed sugars found in dairy, wheat, and certain fruits like apples and pears. Because your gut really struggles to digest them properly, they rapidly ferment in your intestines, which causes a massive buildup of painful gas and fluid. So how do you actually implement this protocol? Typically, a registered dietitian will guide you through 3 specific steps. First is elimination, where you temporarily remove high FODMAP foods. Second is reintroduction, where you slowly bring foods back one by one to test your body's reaction. And finally, personalization. You see, the elimination phase is never meant to be permanent. The end goal is just to identify your unique triggers and then safely expand your diet again so you maintain a healthy microbiome. Let's wrap things up with section 6, evidence-based IBS treatments. We need to look at how we treat the symptoms that might still slip through the cracks of your diet and lifestyle adjustments. If you want to avoid blowing money on expensive, unproven internet supplements, you might want to screenshot this. These are the gold standard evidence-based treatments matched directly to your specific symptoms. If you suffer from constipation, soluble fiber like psyllium or specific laxatives are your absolute go-to. For diarrhea, loperamide, which you probably know as Imodium, is incredibly effective. And for severe cramps and pain, clinical evidence strongly supports peppermint oil or antispasmodic medications like Buscopan to just calm down those spasming intestinal walls. Coupling those medical treatments with some really practical daily habits will vastly improve your quality of life. Just drinking about 1.5 liters of water daily, eating oats or a tablespoon of ground linseeds, and getting 30 minutes of exercise will significantly improve your bowel motility. It's also super critical to avoid skipping or rushing your meals, and try to limit fresh fruit to 3 portions a day so you don't overrun your gut with excess fructose. Now, you might be wondering, can psychological therapies like cognitive behavioral therapy or hypnotherapy actually fix a physical gut issue? Surprisingly, the answer is a resounding yes. Because of that direct gut-brain axis we talked about earlier, psychological treatments are scientifically proven to calm those overactive intestinal nerves, literally lowering your physical pain levels and drastically reducing flare-ups. So the absolutely crucial point I want you to take away from this explainer today is this. IBS might not have a magical permanent cure just yet, but it can absolutely be managed. You do not have to live your life napped out around public restrooms or in constant pain. So what is the one evidence-based habit you can start today to retrain your gut-brain connection? Pick just one lifestyle change we discussed and start reclaiming your quality of life. Thank you so much for joining me for this Meaty Bites with Morsh explainer, and I'll see you next time.